Good evening, ladies and gentlemen, and welcome to your TVC News of September 17th, 2020. Tonight, increase in cases in Ontario. Are we moving towards a new confinement in the province? The Canada-US land border remains closed. Amanda Small returns to Queen's Park, and students are critical on the back-to-school season. The Eastern Ontario Health Unit and the Leeds, Grenville and Lanark District Health Unit will work closely with local schools and school boards. This is in an effort to manage COVID-19 cases during the reopening of schools this month. The two health units have already begun working with the school boards to implement Ministry of Education guidelines to minimize the spread of COVID-19. Teams of public health nurses have been mobilized to manage contact tracing, case management, and follow-up with schools and families. Schools have also increased their infection control procedures that will be activated in the event of a case of COVID-19. Dr. Paul Roumeliotis, Eastern Ontario Health Unit Medical Officer of Health, indicated this week that the priority is to ensure that the school year is as safe as possible for everyone. He says that with the return to the classroom in person, it is possible that cases of COVID-19 may be found in local schools. However, he wants to reassure parents that plans are in place to quickly identify cases. Infection control measures will help protect students and minimize the spread of the virus in schools. If there is a confirmed case of COVID-19 in a school, public health will immediately begin working with the school to investigate any possible exposure and to trace and isolate contacts of the case. Families will be informed of the case as soon as possible and given information and instructions. Parents of children who may have been exposed to the case will be contacted directly by public health and given specific instructions. The status of cases and outbreaks will also be posted on the website of school boards and their respective health offices, as well as on those of schools that have a website. The school will also activate its infection control procedures, including cleaning and disinfection of the classroom and any other affected areas of the school. In the event of an outbreak in the school, public health will determine through its investigation whether it is necessary to cancel classes or close down the school. Dr. Roumeliotis understands that timely and transparent communication is important, not only to help alleviate concerns, but also to keep students as healthy as possible. He says that while every effort is made to keep the school community informed, there's also an obligation to protect the confidentiality of anyone who is confirmed to have COVID-19. He asks families to avoid speculating or spreading rumors about possible cases, especially online. It is important to remember that children's privacy must be respected. Dr. Roumeliotis also points out that with the start of the new school year, there will be an inevitable return to the spreads of common infections such as colds and flu that occur every year. Many of these infections include respiratory systems that may be similar to those of COVID-19. For this reason, Dr. Roumeliotis is asking everyone to remain vigilant for potential symptoms of COVID-19 and to stay home if they are sick or have symptoms. However, one must be wary of jumping to the conclusion that all respiratory symptoms or school absences are related to COVID-19, as in many cases the symptoms may be due to other causes. Public health and school boards are asking parents to use an anonymous online screening tool every day to determine if their child has symptoms and can attend school. The tool also provides advice on what to do if someone has symptoms. Teachers, school staff, and anyone else entering the school will also be asked to self-screen and stay home if they have symptoms. To view your local school board's back-to-school plan, you may consult the websites of the Upper Canada District School Board, the Catholic District School Board of Eastern Ontario, du Conseil scolaire de District catholique de l'Est ontarien, and the Eastern Ontario Public School Board. The progression of the curve for new cases continued to rise in Ontario. There were 350 new cases in Ontario, and more than 29,000 tests were performed in less than 24 hours. Kristen Elliott, Ontario's Minister of Health, explained that nearly 80% of the cases are from Toronto, with 112 new cases, Peel Region with 71 new cases, and Ottawa with 60 new cases. An estimated 64% of the new cases are estimated to be under the age of 40. The total number of cases since the beginning of the pandemic now stands at more than 45,000 cases. However, on a positive note, more than 40,000 cases have now been cured. Closer to home, the city of Clarence-Rockland has 41 cases, 9 of which are active, and Alfred Plantagenet has 46 cases and 1 case active. These are the 2 most affected locations in the Eastern Ontario Health Unit territory. Premier Doug Ford said yesterday that the province will impose stiff fines, the highest in the country, for anyone who does not follow public health guidelines. And Doug Ford's government is once again considering reducing the size of gatherings in parts of Ontario. This would return to a gathering of a limit of 50 people indoor and 100 people outdoors. In response to the alarming increase in new COVID-19 contamination in Ontario, Premier Doug Ford says another containment period established on a regional basis could be implemented. The Premier is calling for accountability from residents, especially those who participate in rallies. At one of his press briefings, he said his government knows a second wave is on the prowl. He, however, hopes he is wrong, but he says it is coming. With the increase in cases, the Premier said all options are now available to contain the spread, including further containment. The Premier reiterated that the size of this wave will depend on everyone's responsibility. He is calling on everyone to comply with the health guidelines. Doug Ford is particularly critical of people who attend social gatherings. All the officials say the same thing: people get careless. He says a small percentage of people don't follow health protocol. OHA President Anthony Dale said the accelerating infection rates in Toronto, Peel, and Ottawa could spread to the rest of Ontario if people don't follow public health guidelines. And on the issue of testing, the Premier said he is tired of seeing the many lineups where people can wait several hours. Changes to improve services are planned very soon. Premier Doug Ford is asking the Ontario Court of Appeal to stop the release of his minister's mandate letters. Mandate letters contain instructions given by the Premier to members of his cabinet. Mr. Ford's predecessor, Kathleen Wynne, had released them, as has Canadian Prime Minister Justin Trudeau. The Ford government argues that the mandate letters reflect the deliberations of Cabinet and should not be subject to the Access to Information Act. 2 years ago, it was the English Language News Network, CBC, that made an Access to Information request. In a ruling last month, the Ontario Divisional Court ruled in favor of the CBC and ordered the province to pay the public broadcaster $17,000 in legal fees. On the topic of CBC News has learned that the federal government has decided to keep the Canada-US land border closed until October 31st. A source with first-hand knowledge of the situation, who spoke to CBC on the condition of not being named, said Canadians should expect the possibility of the border remaining closed longer. The source told CBC News that the federal government is waiting to see evidence that the COVID-19 pandemic in the US is being effectively managed before the government would consider opening non-essential travel between the two countries. According to the same source, the closure may be extended. The closure has resulted in a dramatic drop in traffic between the two countries, although essential workers can still cross overland. The federal government has also taken steps to curtail the movement of Americans through Canada to Alaska. U.S. travelers to the northern state have been limited to 5 crossings in Western Canada and must commit to a direct route. However, some do not respect this order and can stay longer in Canada. And for the first time since July 21st, Ontario MPs returned to Queen's Park for the fall session earlier this week. However, the return to the House did not happen as usual because of our favorite topic, COVID. The topic of the hour is back to school because several Liberal and NDP MPs, Liberal and NDP MPPs, are challenging the Ford clan's way of doing things. And we continue with Amanda Small, who recently closed her constituency office in Rockland. She now has only one office, the one in Hawkesbury, to respond to requests from the people of her riding. I spoke with her earlier this week to understand the reason for the closure. For the past week, the students have been on their way back to school. The school boards have put in place protective and hygienic measures in their institution that everyone must follow. But for some students, it is rather the chaos that reigns in the sanitary organization. Valorous for Children and Adult of Prescott Russell launches a new website, new visual identity, easier navigation, section dedicated to the Valorous Foundation, and restructuring of the content around topics and issues that affect the community. The Valorous website has been improved to make the organization's services more accessible and easier to understand. The new site is designed to address a parent looking for appropriate services for their child, a teenager with a more specific need for information, or a member of the community for more general questions. Among the improvements is a Need Help button that allows the user to quickly contact Valorous on their cell phone. In addition to a completely revamped events section and the addition of frequently asked questions for certain topics, the Valorous website now offers users the option to subscribe to a newsletter. The COVID-19 pandemic posed many challenges for everyone, especially seniors. The federal government wants to continue to improve the quality of life of seniors and provide them with the services they need in their communities. The New Horizon for Seniors program is a federal government program that can help support the growing population of seniors in Canada. It promotes healthy aging by financially supporting organizations that empower seniors and provide them with opportunities to become active members of their communities. So if an organization has an idea for a project that can support seniors affected by COVID-19 or help them stay informed, engaged, and connected to their community, they can apply for funding under the NHSP. Organizations across Canada can already apply and have until October 20th to do so. Well, this covers it, ladies and gentlemen. Thank you for joining me for another episode of TVC News. See something that could make the headlines? Feel free to contact us at nouvelles@tvc22.ca. Thank you for joining us. We'll see you next week.